Doctors can sometimes mistake heart attack symptoms for other conditions like heartburn, acid reflux, angina, panic attacks, or even musculoskeletal pain. Many times, the signs are not as clear as a big pain in the chest and may seem like everyday problems. Especially women can report to doctor stomachache, heartburn, or acid reflux, which are general discomfort or pain in the abdomen. This video tells about 11 mistaken and unknown signs that your body may give you when a heart attack is coming. It works as a guide for anyone who wants to know more about these signals so that they can take care of their health in time. Number 1. Nausea or vomiting can sometimes be a sign of a heart attack. But about 20% of patients report that they feel sick or even vomit when they have a heart attack. It works as a signal that the heart is in distress even though the stomach is showing the signs. Many people mistake this for a stomach bug or food poisoning, but it can be much more serious when it is linked to the heart. Number 2. Common experience is chest pain or a feeling of pressure when a heart attack is on the way. About 70% of patients say that they feel an intense pressure or discomfort in the chest. The pain is not always a burning or stabbing feeling. It can feel like a heavy weight on the chest that makes breathing hard. But many people ignore this sign because they think it is just stress or overexertion. It works as a signal that something is wrong even if the pain is mild at first. When the pain continues for more than a few minutes, it may be the body telling you to slow down and see a doctor. Number 3. Shortness of breath is another sign that many people do not notice until it becomes severe. Nearly 50% of people who have heart problems say that they feel winded even when they are resting. It can feel like a deep breath is not enough to fill your lungs with air. But many people simply think it is due to poor fitness or a little cold. When you feel breathless for no clear reason, it is important to listen to your body and be cautious. Even if the shortness of breath is not accompanied by chest pain, it may be a sign of trouble with the heart. Number 4. Unusual and sudden fatigue can also be a warning sign of a heart attack. Many people feel tired after a long day or a lot of work, but this type of fatigue comes on quickly and does not go away. Around 40% of patients report feeling extremely tired for no reason. It is not like the normal tiredness you feel after a hard day at work. But it is a deep, bone-tired feeling that makes it hard to do everyday tasks. If you notice that you feel unusually exhausted even when you are not doing much, it may be your body sending a warning. Number 5. Pain in the neck, jaw, or back is a sign that many people do not relate to a heart attack. Some patients feel a dull pain in these areas instead of in the chest. Up to 30% of patients report that they feel pain in the neck or jaw. It may work as a signal that the heart is not getting enough blood. But this type of pain is often mistaken for problems with the teeth or muscles in the neck. Many people ignore the pain because they do not connect it to the heart, and this can delay important help. Number 6. A cold sweat can be a sign of something very wrong with your heart. Many people do not realize that sweating a lot, even when the weather is cool, may be a warning. Up to 25% of heart attack patients mention that they break out in a cold sweat. It is not the type of sweat you get from exercising or being outside in the heat. But it is a sudden, damp feeling on the skin that can make you feel very uncomfortable. This type of sweating is the body working hard to cope with a crisis, and it is a sign that should not be ignored. Number 7. Nausea or vomiting can sometimes be a sign of a heart attack. It is not easy to think of nausea as a sign of heart trouble, but about 20% of patients report that they feel sick or even vomit when they have a heart attack. It works as a signal that the heart is in distress even though the stomach is showing the signs. Many people mistake this for a stomach bug or food poisoning, but it can be much more serious when it is linked to the heart. Number 8. Nausea or vomiting can sometimes be a sign of a heart attack. It is not easy to think of nausea as a sign of heart trouble because many people feel sick to the stomach for many reasons. But about 20% of patients report that they feel sick or even vomit when they have a heart attack. It works as a signal that the heart is in distress even though the stomach is showing the signs. Many people mistake this for a stomach bug or food poisoning, but it can be much more serious when it is linked to the heart. Number 9. Dizziness or a feeling of being lightheaded may work as a warning sign for a heart attack. Many patients have said that they feel as if they might pass out when their heart is under stress. About 20% of patients mention that they feel dizzy or unsteady on their feet. But dizziness can be caused by many things, and people often think it is due to low blood pressure or dehydration. When the dizziness comes on suddenly and without a clear reason, it is a sign that you should pay attention to your heart. A steady and unexplained feeling of faintness is a signal that should prompt you to seek medical advice. Number 10. Anxiety or a strong feeling of doom is another sign that many people do not relate to a heart problem. There are times when you feel very nervous or scared without knowing why. Some people call this a feeling of impending doom. This type of anxiety is not the normal worry you have about day-to-day matters. It is a deep and unsettling feeling that something bad is coming. It works as a mental warning that is hard to ignore. Even if there is no physical pain, the strong sense of fear is something that many patients describe when they are having a heart attack. Number 11. Indigestion or a feeling similar to heartburn is a sign that many people mistake for a simple stomach upset. Sometimes, the pain that comes from a heart attack may feel like a burning or aching pain in the stomach. Many people think it is just a case of indigestion or a reaction to something they have eaten. But when the feeling of heartburn is accompanied by other signs, it may be much more serious. A good number of patients have said that the pain in their stomach works as a hidden warning that the heart is in trouble. It is important to notice if the pain does not go away after a few hours or if it comes with other symptoms. Unusual pain in the arm or shoulder may also work as a sign of a heart attack. Many people know that heart attacks are often linked to chest pain, but the pain can also move to the arms or shoulders. It is common to feel pain in the left arm, but about 20% of patients say that the pain may spread to the right arm as well. This pain can be mild or it can feel very strong. But many people think that the pain in their arm is due to a muscle strain or injury from exercise. When the pain in the arm comes on suddenly and without a clear cause, it may be a signal from the heart. It is important to notice that this type of pain can be the only sign of a heart problem in some cases. Number 12. A runny nose is not a typical sign of congestive heart failure. Most people with heart failure experience symptoms like shortness of breath, fatigue, or swelling in the legs rather than a constantly runny nose. But, in some cases of advanced heart failure, particularly when the right side of the heart is involved, extra fluid may build up and cause increased nasal secretions. It works as a kind of unusual signal that your body is holding on to too much fluid. Still, most of the time a runny nose is more likely caused by common issues like a cold or allergies rather than heart problems. It is important to look at all your symptoms together and discuss any concerns with a doctor. The body sends many signals that something is not right with the heart. Some of these signs are common and many people know about them, but many are hidden and can be mistaken for everyday problems. It works as a challenge for everyone to pay attention to small changes that they might think are normal. But sometimes these small signals may mean that there is something serious going on inside. The numbers and figures show that many people do not always recognize the early signs of a heart attack, and this may delay getting help. Many people work hard every day and do not have time to stop and think about how their body feels. But paying attention to the little signs that the body sends is very important. When you have a busy day at work or when you are taking care of your family, it is easy to ignore feelings of discomfort or unusual tiredness. But if these feelings are strong or last for a long time, they may be a sign that you need to see a doctor. It is a good idea to talk to someone who can help you understand if what you are feeling is normal or if it is a sign of something more serious. Some people think that only older adults have heart attacks, but even younger people can experience them. Studies have shown that about 25% of heart attacks occur in people younger than 55 years. But many young people do not pay attention to the warning signs because they think it is not possible for them. It works as a wake-up call to everyone that age is not a guarantee against heart problems. When you feel any of these signs, it is important to take them seriously, no matter how young you are. Lifestyle plays a very big role in how healthy your heart is. Many people try to eat well and exercise, but sometimes habits like smoking or not getting enough sleep may lead to heart problems. But even if you have a healthy lifestyle, it is important to know the signs that your heart is sending. The figures show that many people who have heart problems do not have any history of illness in their family. It works as a reminder that anyone can be at risk, and paying attention to these signals is very important for everyone. The signs described here work as reminders that our bodies try to tell us when something is not right. Many people have learned to ignore small pains or feelings because they think they will go away on their own. But the numbers show that a lot of people have suffered because they did not notice these signals early enough. When you know the 10 mistaken and unknown signs of a heart attack, you are better prepared to listen to your body. It is very important to know that feeling a little pain or discomfort is not normal if it comes on suddenly or lasts longer than usual. Your body sends these signals to help you take care of yourself, and they should never be ignored. Every day, more people learn that the heart is very sensitive to changes in the body. It works as a pump that is essential for life, and when it is in trouble, it sends out many signals. But these signals are often small and can be easily mistaken for everyday problems. The signs we have talked about are not dramatic in many cases, but they work as early warnings that something serious might be happening inside. It is a reminder that the body has its own language and that even a slight change in how you feel can be very important. When you start to feel unusual chest pain, shortness of breath, or any of the other signs, it is a good idea to take a moment and think about what your body is saying. It works as a gentle reminder that you should not ignore your feelings, even when life is busy. Many people have been lucky and have recognized these signals early on, and they got help in time. But there are others who have ignored them and ended up having a full heart attack. It is always better to be safe and to have a checkup when you feel that something is not right. The story of these 11 signs works as a lesson for anyone who wants to take better care of themselves. They show that a heart attack may not always come with a dramatic or very painful signal. Sometimes, it works in whispers that can be missed if you are not paying close attention. But when you notice a sudden feeling of fatigue, a cold sweat, or a strange pain in your neck or jaw, it is time to listen. The body does not lie, and every little sign is a chance to get help before things get worse. It is not hard to take a moment each day to check in with your body. Even if you are busy with work or family, listening to small changes in your body is important. Many people work long hours and forget to take breaks, and they may miss the signs that the heart is sending. But taking a short walk, resting for a few minutes, or just sitting quietly can help you notice if something is not right. It works as a way to stay in tune with yourself and to keep your heart healthy. When you feel that something is off, it is best to talk to someone who can help you understand what is happening. It works as a reminder that doctors and nurses are there to listen and to help you figure out if what you are feeling is normal or if it is something that needs treatment. Many people are afraid to see a doctor because they think it might be nothing serious, but it works as a way to catch problems early. The sooner you know what is happening, the sooner you can start taking care of yourself in the best way possible. This talk about the 11 signs of a heart attack works as an invitation to everyone to be more aware of their own body. It reminds us that our hearts are very important and that they work every day to keep us alive. Even when you feel a small pain or little unease, it is wise to stop and pay attention. Your body sends these signals in a way that is easy to miss if you are not aware. But when you learn to listen, you give yourself the best chance to stay healthy and safe. The story we have shared works as a simple guide to understanding some of the hidden signs of a heart attack. It is easy to miss these signs if you think they are just part of everyday life. But many people have learned that by paying attention to small changes, they can prevent a bigger problem. The numbers show that many heart attacks can be prevented when patients seek help early. It works as a reminder that a few extra minutes of care and attention to your body can save your life. It is important to share this kind of information with family and friends. When more people know about the signs that may come before a heart attack, more lives can be saved. But it is not only about knowing the numbers or the percentages. It is about understanding that your body works in a way that sends clear messages when it is in trouble. The signals may seem small, but they work as powerful reminders that health is the most important thing in life. The signs of a heart attack are not always dramatic or easy to see. They may come as gentle warnings that are easy to overlook on a busy day. But every one of these signs works as a clue that your heart needs attention. It is important to take these signals seriously, even if you feel fine most of the time. When you listen to your body and notice even small changes, you give yourself a better chance to get help when you need it most. Characterization of a novel symptom of advanced heart failure. Taking care of your heart is a lifelong journey that works best when you pay attention to every signal your body sends you. It is not always about big changes or dramatic symptoms. Sometimes, a slight pain or sudden feeling of tiredness is enough to tell you that something is not right. But these signals are there for a reason, and they work as early warnings that you should never ignore. By learning about these 10 mistaken and unknown signs, you give yourself a chance to enjoy life with a healthy heart.